A 49-year-old patient presents with an inadequate amalgam filling and secondary caries in tooth 3-6. First, place an Optrogate cheek and lip retractor in the patient's mouth to enlarge the treatment field. To do so, grasp the thicker intraoral ring by reaching through the thinner outer ring. Press the intraoral ring slightly together until two wings form. Then, insert one of the wings into one corner of the mouth. To facilitate the placement of the second wing into the other corner, you may use your finger or a mirror. Position the ring first in the lower and then in the upper vestibule. The ring glides more easily into the gingiovobuccal fold if the patient's mouth is only slightly opened and the lips and soft tissues are relaxed. Whilst the tooth is still moist, select the shade of the composite using a shade guide. Examine the occlusion with the help of articulating foil. Take the occlusal relations into account when extending the cavity. Avoid positioning the margins of the filling in the area of the occlusal contacts. Ensure that the treatment field is sufficiently dry. This is best achieved with a rubber dam. We recommend that you use a rubber dam that features an anatomical shape, such as the Optrodam. Punch holes in the places where you want to expose the teeth. Seize the upper and lower rim of the intraoral ring by reaching through the outer ring and press together slightly. Insert the intraoral ring into the buccal corridor on one side so that the elastic component embraces the corner of the mouth and the outer ring is located extraorally. Finally, place the intraoral ring behind the lower and upper lips. The Optrodam now sits in a stable position. Place a clamp in the area of the distal molar. Use dental floss to expose the proximal contact points. Next, remove the inadequate filling. Prepare the cavity according to the principles of the adhesive technique. In other words, preserve as much tooth structure as possible. Bevel sharp enamel edges and smooth them out using a 25-micron diamond burr. The existing cavity is 5 mm deep. Adapt the cervical areas of the sectional matrix. The bond to enamel can be improved by selectively etching the prepared enamel with phosphoric acid, for example, an etch. Allow the gel to react for 15 to 30 seconds. After that, apply water spray for at least 5 seconds to remove the gel. Disperse the remaining moisture with compressed air. Dispense tetric N-bond universal directly from the Vivapen onto the entire tooth surface to be treated, starting at the enamel. Brush the adhesive into the tooth surface for at least 20 seconds. Disperse excessive adhesive with compressed air until a glossy, immobile film layer results. Light cure tetric N-bond universal for 10 seconds with a curing light that produces a light intensity of at least 500 milliwatts per square centimeter, such as the Blue Phase N with a light intensity of 1,200 milliwatts per square centimeter. Use tetric N-Flow bulk fill to apply the first increment in a maximum thickness of 4 mm. Tetric N-Flow bulk fill is suitable for discolored tooth structure, as its translucency diminishes during light curing. Polymerize tetric N-Flow bulk fill for 10 seconds using a curing light that emits a light intensity of at least 1,000 milliwatts per square centimeter, such as the Blue Phase N. Next, apply a covering layer of tetric N ceram bulk fill in a layer thickness of up to 4 mm. Contour the occlusal surface and fissures of the restoration using a handheld modeling instrument, such as the Optrosculpt. Light cure tetric N ceram bulk fill for 10 seconds using a curing light with a light intensity of at least 1,000 milliwatts per square centimeter. With a light intensity of 1,200 milliwatts per square centimeter, the Blue Phase N light is ideally suited for this application. Next, remove the Optrodam. Before you take the rubber dam out of the oral cavity, carefully cut the interdental latex septa. Then, grasp the outer ring and slightly press it together so that the intraoral ring is loosened from the gingiovobuccal fold. Next, remove the dam carefully from one corner of the mouth and then from the other. Check the occlusion and adjust as necessary. Remove irregularities on the surface of the filling using a fine-grained diamond. The grit size should be between 15 and 25 microns. We recommend that you use a one-step polishing system, such as Optropol, at a medium contact pressure of 2 Newton, to polish the restoration. The polishing procedure is performed under water cooling. In the process, polishing residue is evacuated. At the end, apply a thin layer of Fluor Protector N using a Viva brush or a dental brush. Let the varnish dry for 1 minute.